So before we get started, just want to let folks know that this call will be recorded, and we will send out the recording as well as a full press release immediately after today's call. Today, you'll hear from UFCW's International President, Mark Barone, as well as 3 of our grocery retail members from across the country. After their remarks, we'll open it up for questions and call on reporters individually to ask your question. This call is planned for about 45 minutes. After questions, we will then close with final remarks from President Barone. If you have not done so yet, please rename yourself to include your name and the outlet you are with in the participant list. If you're unsure how to do that, please indicate which outlet you're with before you ask your question if we do call on you today. And so if you have any questions you'd like to ask on the call, please email Abraham White, that's awhite@ufcw.org, and we will add you to the queue. If you're not able to email Abraham with your question, please use the raise your hand feature and we'll try our best to get to you today. So with that, I would like to turn things over to Mark Barone, International President of the United Food and Commercial Workers.
Thank you, Amy, and I want to thank everybody for being on the call today. As Amy indicated, my name is Mark Barone, and I'm the International President of the United Food and Commercial Workers, America's largest food and retail union. You know, as many of you know, the UFCW represents over 1 million essential and frontline workers in grocery stores, meat packing, food processing, retail pharmacies, healthcare, and even nursing homes. And let me begin by saying what I hope that I'd never have to say. Right now, America's essential workers are facing a holiday season of an unparalleled level of risk and threat from this growing pandemic. With more than 1 million new COVID-19 cases in the past week and deaths spiking to unprecedented levels in city after city, we're entering what could prove to be the riskiest and deadliest phase of this pandemic for millions of essential frontline workers. You know, I can't stress enough the level of concern that we're hearing from our members right now. Simply put, the fear that they feel is as great, if not greater, than it was in the early days of this global pandemic. Once again, these workers are being asked to take even more risk, even as they've had their heroes' pay taken away and face worsening store safety and workplace standards. Health and safety standards that have been weakened considerably over these many months, based on what we're hearing as you will hear. America's largest companies are simply not doing enough to stop the spread of this virus or to protect these essential workers. With respect to food, retail, and grocery stores, we're now in the midst of what is the busiest 5 weeks of the year in terms of store traffic. We've already seen a surge in store traffic from Thanksgiving and holiday shopping. Make no mistake, unless we take immediate actions beginning this holiday week, many more essential workers will become sick and more tragically may die. And as the threat of this pandemic grows, so will the threat to our communities and our food supply. Please understand, I'm not trying to be melodramatic. To date, the workers on the front lines of this crisis have already paid an incredible price. Based on what we know, at least 350 of our members have died, including 109 grocery workers. In addition, over 48,000 of our workers have become sick or exposed, including over 17,400 grocery workers. The actual number of essential union and non-union workers who've become sick and who have died is undoubtedly much, much higher. Sadly, we still don't know how high the cost has been because to this very day, companies like Walmart, Amazon, Kroger, and so many others refuse to disclose of how many of their workers have become sick or have died from COVID-19. And you may ask yourself why. It's because they don't want the American people to know. They don't want the American consumer to be afraid to shop in their facilities. So who pays the price for this silence? America's essential workers, our families, and our communities. This must change. And to help protect these workers during this critical time, the UFCW is announcing the following actions. First, as a part of our nationwide Shop Smart campaign, we're going to be targeting customers in major cities and markets that have major spikes of COVID-19 cases, such as Los Angeles, Houston, Dallas, and Milwaukee. This new initiative will urge the American people to take key safety actions this holiday season by committing to wear a mask, following social distancing guidelines, and safely discarding their masks and personal PPE whenever they shop. Second, we're going to be sending a letter to all major food retail CEOs to publicly support new health, safety, and wage standards throughout this holiday season for union and non-union workers alike, as long as this current spike in cases persist. In this letter, we're asking these CEOs to publicly commit to free COVID-19 testing for all their workers, provide free PPE to all employees, enforcing mask wearing standards at all stores, providing paid sick leave to all sick or exposed workers. And 5, freeze all stock buyback plans and dividends that companies have been paying, like Walmart at over $500 million. We understand that Target plans to do that this spring or this fall. We also know that Costco paid a special dividend of $4.4 billion. Kroger has done 5.9 with another $1 billion on the way for fiscal year ending 2020. And we want them to reinstate immediately hazard pay, because these workers are the ones that are taking the risk until this pandemic is under control. In addition, we'll be reaching out and asking all our nation's governors to adopt strong and uniform COVID-19 safety standards at all food and retail stores across our entire country, and to prioritize the enforcement of these safety standards throughout our holiday season. Now, you will soon hear from these actual frontline workers. Critical safety standards at these food and retail stores have been consistently deprioritized or eliminated. And once again, we're seeing mask wearing that's neither mandatory nor enforced in these stores. PPE for essential workers is becoming scarce again. Sufficient sanitizing is not happening enough. And workers are once again being asked to choose between not being able to pay their bills or working when they're exposed or they're sick. Even worse, the truth of when these workers become infected is being withheld from the actual workers and the customers. All of this, these safety failures are happening even as a new report has come out from the Brookings Institution. It highlights that America's largest food retailers could easily afford to do much more. So you all know, here are the facts. Amazon's profits are up 53%, even though their company has ended hazard pay, fired whistleblowers, and has at least 20,000 of its workers that have been affected by COVID-19. Walmart's profits are up 45%. And instead of hazard pay, the company's handed out a $10 gift certificate for a turkey. Kroger's profits are up 90%. And yet they refuse to restore hazard pay despite a growing number of worker infections in their stores. Even worse, just weeks after authorizing another $1 billion in new stock buybacks and dividends. Kroger's seeking to make healthcare cuts in some locations, despite that this healthcare crisis is getting worse by the day. Overall, the most top retailers ended hazard pay in June, on average, more than 130 days ago. Now, just as over 6 million frontline workers in retail face the deadliest phase of this pandemic, they're being asked to take on more terrifying risks, even as they earn less. Respectfully, what American who works from home right now would be willing to work at a grocery store for what these men and women face or get paid? Given the spikes in COVID-19 cases and the deaths that we're all witnessing, it's time that our elected leaders and this nation's food and retail CEOs take immediate action. They must do more now, and waiting is no longer an option. I want to thank you all for being on this call, and I want to introduce to you the first frontline worker on our call, Janet Wainwright, who's a member of UFCW Local 400. She works at a Kroger store in Yorktown, Virginia. Janet?
Hi, my name is Janet Wainwright, and I've been with Kroger for 5 years, and I work in Yorktown, Virginia. Since the beginning of the pandemic, there has not been a day that I and my coworkers do not worry about our health and our safety. These are not just words. We have already had one Kroger worker die and 2 people end up in ICU. Americans need to know the terrible choices that workers like me are being asked to make every day. In my area, Kroger used to provide paid leave to workers who tested positive for COVID-19. But now Kroger workers who test positive have to take 14 days leave with no pay. Simply put, we're being forced to work because we can't live without our jobs. Every day, this makes us paranoid and fearful because it makes people more likely to come to work sick. It makes me wonder how many people are being exposed. If you want to know one reason why this pandemic is getting worse, it's very simple. We haven't learned, we haven't changed. And grocery companies like Kroger are choosing to make things worse. Let me be specific. Mask enforcement for customers is still an issue in our stores. Nearly 9 months into the pandemic, a pandemic that is only getting worse, managers tell us not to even approach customers who refuse to wear their masks. And when we tell managers about customers without masks, they don't do anything. Kroger used to offer masks to customers by the front door, but they moved them behind the service counter because managers worried about customers taking too many masks. Are you kidding me? We should be providing as many masks as customers need. Every mask customers take gets worn and helps reduce the spread of COVID. Does it make any sense to tell your employees to wear masks, but not your customers? Kroger is prioritizing pennies over the lives of workers and customers. If you fail to enforce masks in stores, you're putting lives at risk. We all know this better if America's largest grocery company won't do it. I was surprised so many Americans won't. With Thanksgiving and holiday shopping here, social distancing is now an even bigger problem. Customers crowd the stores, and managers refuse to limit the number of customers. The important things that were done in the spring, like frequent sanitizing and cleaning, or checking employees' temperatures, are just not happening like they used to. What further demoralizes us is that we are asked to put our lives on the line in the middle of a worsening pandemic, and yet companies are refusing to provide hazard pay to workers like us on the front lines. My question is, why does Kroger think this crisis is over? Because it is not. How many more grocery workers and Americans need to die before these grocery store companies realize this? Please know I believe in what I'm doing. We are helping feed families in our communities. We're proud of our jobs. But you can't treat people like this. You can't ask someone to risk their lives for less. We've earned and deserve better than this. Every grocery store and essential worker in America deserves better than this. On behalf of workers like me, I'm asking that every American and every grocery store company like Kroger remember their responsibility. Provide for us and for your customers. Value our lives, not just your bottom line. Because this terrible pandemic is not going away and our lives matter. Thank you.
Thank you, Janet. Thank you very much for your words today. Now we're going to hear from Rachel Fournier, who's a member of USCW Local 770 and works at Ralph's in Los Angeles, California. Rachel. Rachel.
Sorry, I was muted.
Christian must have did that.
Yeah. So my name is Rachel Fournier, and I've worked for Ralph's for 16 years as a cashier and a bagger here in Los Angeles. As we all see, COVID cases are exploding in California and across the country. Everyone who works in my store is afraid of getting infected. There isn't a day that goes by where we don't wonder, is this the day that I'm going to get exposed or infected? And despite the growing danger, it sometimes takes up to 2 weeks for us to be told that a coworker has tested positive. 2 weeks. Managers will actually tell us not to worry, saying, it was so long ago and that we're probably all fine. It's because of actions like these that the pandemic is getting worse. Given the essential jobs that we do, America's grocery companies like Kroger, Whole Foods, and others should be putting safety first and making sure that we get tested if we interacted with the worker who did test positive. Those of us who work in a store shouldn't be the last to know. We should be some of the first to know. How broken is this process? When a worker becomes sick, management is not proactive about letting us know if we were in close contact with that person. This is not helpful at all because this leaves us workers guessing who it might have been to figure out if we should get tested. And to top things off, if we choose to get tested without showing symptoms because we feel fairly certain that we worked closely with the person who tested positive, we don't get paid sick leave while we wait for the test results to come back. And this creates a culture where workers are not encouraged to get tested and they become hesitant to do so since they can't afford to stay home without pay until they get the test results. By now, we all know that people can be carriers of the virus without showing symptoms. Without paid leave that covers when you're waiting for test results, workers are more likely to come to work sick because they need the money. And this puts other workers, customers, and the community at risk of being infected. The truth is, it's even worse than just a failure in testing or paid sick leave. Stores are getting more crowded as people stock up for the holiday or because of the new lockdown in California, but store managers refuse to have a person counting to keep stores from having unsafe numbers of customers. In fact, we have a sensor at the front entrance that's supposed to let us know when we're getting crowded, but it doesn't seem to work at all. How in the middle of a pandemic, getting worse every day, are we not doing more to keep essential workers and the public safe? When it comes to social distancing, there is no enforcement of social distancing, and I'm seeing no effort to ensure that customers properly wear masks. Proper cleaning and sanitation is also being ignored by managers. We're constantly running out of sanitizer and wipes, and cashiers are left to be the one to order these things themselves. With a huge influx of customers as winter approaches, we usually are so busy that we have little to no time to actually clean the store. And to add insult to injury, you have companies like Kroger, Whole Foods, and Albertsons who still refuse to pay hazard pay despite the reality that the risks from COVID-19 are worse now than when they paid hazard pay back in the spring. How does that make sense? Are our lives worth less now? This has been so upsetting for all of us who are still on the front lines of this pandemic. Hazard work deserves hazard pay. With Thanksgiving shopping this week and many people stocking up for winter, it feels like everyone, the companies, our elected leaders, the customers, have forgotten the lessons from the spring. We're a long way from getting back to normal. The pandemic is still here. The threat is more real than ever. And for the sake of all of our families and every essential worker in America, we're asking companies like Kroger, our elected leaders, and the public to help keep us safe. Thank you.
Thank you, Rachel. Look, we're here for you guys, and I do know that the new administration is here for you guys too. We had a conversation with them last week about this, and they are very much focused on trying to do something in order to make sure that our essential workers are protected. Finally, you're going to hear from Nora Abawayda, Now, Nora is, I think she's on a cell phone. She's not, we don't have audio or video on her, but she is from UFCW at Local 1000. She's a member that works in a store in Dallas, Texas. So Nora, are you there?
Hey, Mark, it looks like we lost Nora.
We're having technical difficulties today, huh? Okay, so let's see if Nora comes back on, but we can't open it up for questions until that happens, if that's okay. You want to try that?
Yes. So the first question that we have came from Eleanor from Politico. Eleanor, I'm going to unmute you if you want to ask your question.
Hi, thank you so much for organizing this call. My question is for President Perone. Basically, a lot of the paid leave provisions under Families First are set to expire at the end of the year. You know, that's the COVID-related paid leave. It's the unpaid leave related to childcare. Is this something that you guys are tracking? And, you know, if yes, how do you anticipate it impacts essential workers?
We think it's going to impact them dramatically because of, if you think about a retail food operation, it's open 365 days a year, 7 days a week, 24 hours a day. And since the schools are in many cases closing down, since daycare centers are not available to our members, we're very concerned about this. Initially in the pandemic, you may recall the UFCW was one of the people that was at the forefront of fighting for essential worker status. The reason why we did that is that it gave them access to low-cost daycare centers for our members, and we were very concerned about that. We are really disappointed at this point in time that the argument still is going on, raging in Washington, D.C. between the Senate and the House. We think that there needs to be a bill that's passed. We think it needs to take care of our state governments, our local governments. It also needs to take care of the essential workers in this country, and needs to make sure that it provides that aid that's needed, both in from people from being evicted from their homes, as well as being able to provide that necessary childcare that they're going to need if they're going to continue to service.
Thank you.
Thanks, Eleanor. And it looks like Crystal Haynes from Boston 25 had your hand up. Did you still have a question?
Sorry, I had to unmute. Yes, I did. My question is there was a recent survey that came out where more and more customers believe that the stores should be closed down more days of the week, especially around the holidays, for several reasons, most of them with essential workers and exposure to COVID. Do you all believe that that should happen, that there should be more days where the stores are closed rather than have even limited hours on holidays that will keep you safer?
I think that what could be done, Crystal, is that during the evening hours, late evening hours, they could assign more time to thorough cleaning in those stores, because there's very few customers from about midnight through about 6 in the morning, right? And they could definitely clean the stores and they have crews there. However, those crews at the moment are presently assigned to restocking shelves and things like that. But they could, in fact, increase the number of people there and increase the deep cleaning that should be taking place in some of those stores. The problem really is, though, Crystal, I think the biggest problem is that we do not know, okay, and don't have the transparency about who, in fact, has been infected inside a store. So that's a problem, because that can be a transmission point. Of course, you could potentially get it from a customer that's not wearing a mask, you know, and then we don't necessarily know who in the store has been infected. So I do think that there needs to be more deep cleaning in the stores. You know, look, I actually do the grocery shopping in my household. And I've noticed that we don't have the sanitation wipes coming in to wipe off the carts like we used to. A lot of times they're not there. I've noticed that the staff inside the stores don't have the sanitation bottles at the end of their registers like they used to. I used to see in the very beginning of the pandemic, people wiping down the actual conveyor belts after each customer. There were people that were stationed to make sure that there was social distancing at the checkouts, which we're not seeing anymore. There used to be counting of customers. Rachel talked about a sensor that actually did it, okay? In our case, in the area that I go to store in, they didn't have that, but they had a person. But instead of hiring, putting 2 people at each end, they closed one door and put a person there, stationed them there to count. But actually, the problem with that is that we know now that you need more ventilation inside the store. So shutting the one end of that store down actually created a bigger problem than it was helping by then limiting the number of people in the store. And so we just need to do better at cleaning. And we need to do better within, our ventilation systems, and we need to do better with mandatory mask wearing. Now, look, here's the reason why they're not doing it. They didn't even want our members wearing masks in the very beginning of this pandemic because the CDC had said, oh, you shouldn't wear a mask unless you're sick. There's your sign. There is more concern about the consumers being concerned that there is a possibility for infection inside the store than they're concerned actually about what's happening. Because they were more concerned initially about, oh, you don't want the customer to think you're sick. Now they don't want to press the customers about wearing the mask because they're afraid they're going to run the customers off. This is consumer-based problems that we're seeing right now, I think. Okay.
Can I put that question to the 2 workers? Would having would having the holidays make you feel like completely off in terms of like all the staff are at home on Thanksgiving and Black Friday and Christmas Eve and Christmas Day and all of those, would it make you feel safer?
Yes,
Yeah,
it would
I think
make
so.
us feel safer.
But you'd want to be paid, right, Janet?
That would be nice. We have bills.
Yeah.
And I do think that we would be safer, quite honestly, but the challenge, of course, that we have is that, these workers need to work every single day. And if we're going to be open, we need to make sure that they're safe.
Are there states that are doing a better job than others? Like we're here in Massachusetts, and I know this is folks from all around the country are on the call. Are there regions that are doing a better job, or grocery store chains or retail chains that are doing a better job than others?
Look, I do think that if you look at California, we've had 1,000 infections in the state of California. And you think about the size of the population. But then in Texas, we've got 1,300 and the population's smaller in the state of Texas. So in some cases, the governor in the state of Texas was very slow about the mask mandates and having the conversations. And consequently, because of that, I think we have a higher percentage on a per capita basis of workers in Texas that got infected than say the ones in California. And I do think that states like Maryland, state of New York, the problem with New York initially, to be honest with you, is that it got here so quickly, they didn't even know it was here because, the president was talking about it coming from China, but it really, on the East Coast, it came from Europe, right? And we got infected very quickly that way, and therefore it got out of control very quickly. But some states since then have done better. New Jersey's doing better. New York's doing better. But there are states like through the Midwest where we've got members that have not done nearly as well. And on a pro rata basis, it's much different numbers.
And folks, we are coming close to the end. So again, if you have any questions, please feel free to email Abraham White or use the chat feature or raise your hand. Again, that's awhite@ufcw.org, or use the raise your hand feature, or you can even drop your question in the chat.
Amy, did Nora happen to get back on by chance?
Unfortunately not. We couldn't get Nora, our tech, to work.
Okay.
So Mark, it looks like there's a question in the chat from Brad Underwood. What are you seeing or hearing in the Midwest, specifically Ohio?
Specifically in Ohio, I think that I was very pleased to hear that Governor DeWine was actually going to enforce the mask mandate. I do think, however, it was delayed, and we are hoping, at least through the holiday season, because they're more aggressive on the mask mandate, we're hoping that it sort of blunts the curve. What I'm afraid of is that while we're talking about Thanksgiving and we're having this bump up from Halloween and through the end of summer, Labor Day, that we're going to see another bump here at Thanksgiving. And then we're going to see another bump at Christmas, and then another bump on New Year's. And I'm afraid that we are not going to have a real flattening of the curve until about the 4th week of January. I'm really afraid about that. But right now, I think that the curve will be flatter in Ohio based on what he did recently than what it could have been if he hadn't done that.
Okay, and so it looks like we'll move to closing remarks, Mark.
Well, first of all, I want to thank Janet and Rachel for sharing your stories. Look, just so you guys understand something, nobody can explain this better than you can. We can share some of the stories that we've heard, but it is much more visceral when these reporters hear directly from the workers. And I want to thank the reporters for the following reason. Your efforts to highlight these stories throughout this pandemic, I have to be honest with you, I think it's saved hundreds of thousands of lives. You may not see it that way, but I do. Because if it wasn't for the outcry in the media about what needed to be done on behalf of the essential workers and the first responders in order to protect them, I do think that the companies and some of the government, different state governments would have been much slower at their response time. And so from the bottom of my heart and all of our members, we want to thank you for what you've done, and we want to wish you a happy and safe and healthy holiday season.
Mark, it looks like, sorry, we did have one question that came in the chat asking how the union gets its death and infection rates while retailers don't give numbers.
Okay, so we have local unions that are strategically based around the country, and there are representatives that visit stores, talk to workers. We also have a website that we're gathering data off of when workers tell us. We are presently engaged in a joint campaign with the College of Public Health at the University of Nebraska Medical Center. That is the hospital where they took the first initial COVID patients that were on the cruise ship, as well as it's the hospital that ultimately took care of the Ebola patients when we had the Ebola outbreak in the globe several years ago. We've been working with them to do a track and trace program. We've been meeting with them over the last several weeks. Before now, it was definitely not scientifically done. It was just word of mouth, people telling us about people that were infected, us getting that information from the ground level and feeding it back into Washington, D.C. What I would tell you is this: the numbers that we've got, those numbers are accurate in the respect of what we've been told. What's not accurate, I fear, is that the numbers are much higher than what I reported to you. And we're trying to get our hands around that right now, since we can't get, any of the employers to come forward with it about it. Now, look, I understand there's HIPAA requirements and you have to protect somebody's interest. I get that. But there is no reason in the world that they couldn't indicate to us that we had a person in one particular department, which may have ultimately exposed other people, and then we could protect them from that as well. I hope that answered your question.
All right, thanks, Mark. And again, folks, we will send out a full press release along with the recording of this press call. Thank you for joining us. Have safe and healthy, happy holidays, and we will see you on the other side of Thanksgiving.